at San Antonio, I had the pleasure of presenting the results from the AMEERA-1 trial. This is a phase 1/2 trial which evaluated oral amcinestrant, which is a selective estrogen receptor gamma modulator, or SERD compound, one of many in this class that are emerging really as an oral option outside of fulvestrant. Fulvestrant's an active great drug, but its IM delivery makes it uncomfortable for patients, and potentially the oral SERDs are a way to improve upon the activity in this class. There are down modulators and degraders out there, and this compound is moving along into actually second line studies in phase 2 and in first line phase 3 randomized trials. This data is the data that got to the starting dose for the single agent monotherapy. We enrolled patients in a couple different arms. One had more heavily treated patients and one had less heavily treated patients, for a total of 62 women who received single agent therapy at a range of doses from 150 milligrams to 600 milligrams. And the final dose that emerged from the trial was 400 milligrams. The oral SERD is really active in breast cancer in these patients, achieving stable disease in a third of patients in the entire group. But when we reduce that just to the women who've not received prior targeted therapy, the response rate, and combined with clinical benefit, was more like 2/3, 64%. And interestingly, the drug amcinestrant showed a clinical benefit with patients who were either ESR wild type or mutant, and some patients actually cleared their ESR mutations on study, but there did not appear to be a relationship between the ESR mutation status and the response. So the plan for this drug, as I described a little bit earlier, is to move it forward in multiple settings. We already have treated many patients in combination with another agent, molecularly targeted agent, CDK4/6 inhibitor, palbociclib, and this data is looking promising, and we hope to present that in another 6 months, the parts C and D, the combination arms, to share the activity of the agent in that setting, which we all anticipate would be the more common setting that these drugs were given in. Thanks for your attention.